Hello and welcome to Keep Talking, a community dialogue about mental health. My name is Maxwell and I am the manager of the Office of Continuing Education at the Brattleboro Retreat. The Brattleboro Retreat is an almost 185-year-old psychiatric and addictions care hospital located in southeastern Vermont, where it serves children, adolescents, and adults in a variety of inpatient, outpatient, and residential settings. The Brattleboro Retreat offers care and courage when being human hurts. Today I have in my studio a woman by the name of Clare Munat.
I am happy to be here, Gay, and thank you for inviting me.
Well, it's just great. So I wanted to say a little bit about you and then ask a little bit about you.
That's fine.
You are a member of the board of the Vermont National Alliance on Mental Illness. It's otherwise known as NAMI, correct?
Yes.
And you are also a facilitator for the NAMI Connections Support Group, a peer-led support group, and we'll get back to the definition of what peer is in a few minutes. Mm-hmm. And you are also a member of the Brattleboro Retreat's Consumer Advocacy Council as a family member of a person with a mental illness.
Yes,
All right.
that's
Is
right.
there anything else that I've missed, Clare?
I'm also a member of the State Program Standing Committee for Adult Mental Health, and it sort of functions as the mental health board in the state of Vermont.
Great.
And it's people are appointed by the governor.
Wow. So you have many hats that you're wearing at once.
I do.
Let me just circle to Clare Munat, the parent, and to hear a little bit about your story, because you came to NAMI as a parent.
Yes, did.
And I wonder, what was it? How did you find NAMI, and how did they help you?
Okay, what happened to me is my son started demonstrating symptoms of something that was wrong. He was talking to people who weren't there. He put locks on, padlocks like you used to have in high school, on all of his dresser drawers. He threw the remotes in the woods. I didn't know what was going on, and I thought, I have magical powers as a mother. And I thought, if he takes a long nap and takes some vitamins, he will be better. That didn't happen. One day I came home from a meeting, he packed his bags, and he said, I have to leave or I'm going to die. I said, what do you mean? And he said, I can't stay here. And I said, where are you going to go? And he said, I don't know.
How old was he at this point?
22.
22.
And so he said, I'm going down to Manchester, I'm going to get a bus. I didn't know where he was going. So here again, magical thinking, I thought, I'll drive him down to Manchester. And on the way to Manchester, I'll convince him he doesn't really want to leave home. Well, that didn't work out either. So he got on a bus in Manchester and he ended up in Richmond, Virginia, where he lived on the street for 9 months. Not 9 days, not 9 weeks, but 9 months he lived on the street. And we used to send him money by a Western Union about every 6 weeks. And I had nightmares trying to figure out how was he living. I mean, you can only imagine the nightmares. About maybe 2 months into this, somebody said, why don't you go see a therapist? And so I went to Sherry Alper, who was a therapist in Manchester, and she said, well, there's such a thing called NAMI, and they are having this family support group in Arlington, and you might want to think about taking it. And it was only going to start in a short period of time, 10 days. So I didn't sign up for it, I just showed up. And I showed up in the Arlington church, and there was this very lanky woman with a southern accent teaching this class, and I thought, who in God's name is she, and what's she doing in Vermont? Well, this happens to be Joyce Burland, who is the woman who recently retired as NAMI National's education director. She taught the class, and I went to every single one of them, and I learned so much that was so much help to me.
What about that class grabbed you?
Well, it told me that I didn't cause my son's illness. I have no control over it. And the feelings I'm feeling, like guilt and frustration and anger, and some days I wish, I could wake up and he wouldn't be living in my house. And all those things are perfectly natural responses to the trauma of having a child living with mental illness. And so Joyce got me involved with NAMI. She said, you know, the class ended in December. I was on the board in April. And a year later, I was NAMI Vermont's president.
Wow.
Joyce has that way of throwing a net over you and dragging you in. She is a very powerful woman and a very intelligent woman. And the reason she wrote this course that is all over the country and other countries around the world
and
is...
the name of the course is what?
Is the Family to Family class, the Family to Family course. And she got tired of being a mother with family members who are living with mental illness and have everyone tell her it's all the family's fault. It's all dysfunctional families that cause mental illness, and she just had to accept it. And Joyce didn't do that. She got her degree, she wrote this program, and it's incredibly successful and is so helpful to families. It helps you know what kind of boundaries you should have for your child to live with you. When should you draw a line and say, this is behavior I will not accept? And how to live with this and how to help your family member.
And you say this is for family members,
This is
but
for
this is
family
not
members.
this is not just parents. This is
For
brothers, sisters.
Brothers, sisters, aunts, uncles, cousins, anybody. It could even be a friend. We've had friends come who say, I don't know what this is. I don't know what to do about it. How can I help this person? And the Family to Family class will do that. It's transformative. It's a wonderful experience for everybody.
Did that change your relationship with your son?
Yes, it did. Because, you know, in NAMI we say we separate the person from the illness, and that means at what point is somebody responsible for their behavior, and at what point is their illness affecting how they're behaving that they don't understand. Oftentimes people have a long pause. When you say something to somebody, there's often a long pause before they respond. They respond because they're trying to process what you're saying. And this is an accommodation we need to make for certain people. I'm living with major depression, and that's why I'm doing the Connection Support Group. The Connection Support Group is of, by, and for people living with mental illness. It's totally confidential. We do it on Tyler 2 at the retreat, and we also do it at Rutland Regional Medical Center on the psychiatric unit. And it's a place for people to come where they feel welcome, they can express any feelings they have, and it's to help them understand.
This is for people who are suffering from mental illness. And it's
people,
called again what?
The Connection Support Group, the NAMI Connection Support Group. And today we had 11 people. We had 11 people at the retreat who came to our group.
Can anyone show up for this?
Anybody who's on the unit.
I see. Okay.
And in the community, we have groups in the community too. We have one very active one in Rutland, and fortunately, several of those people were clients, patients, peers at Rutland Regional Medical Center on the psychiatric unit. And they live in the area, they come out, and they start going to the Connection Support Group. So when you talk about continuum of care, when people are released from hospitals, there is a place where they can feel welcome and support in the community. And so it's a very, very, very valuable thing. And I'm perfectly happy to be involved with it. I'm very pleased to be part of it.
Well, we're lucky that you're in our state doing this valuable work. Well, you know, what helped you? I'd like to know what in particular, what are the things that stand out? You said something about the fact that you felt some relief about, I didn't cause this, I didn't cure that. You know, it makes me think of what is talked about in the Al-Anon rooms, which is, you know, when families are struggling with having an alcoholic or an addict, one of the Al-Anon maxioms is, well, I don't even know if that's the right word, but at any rate, the 3 C's. You didn't cause it, you can't control it, and you can't cure it, which has to be a really hard thing as a parent to accept. I didn't cause this, and I can't cure it because I used to be able to give them antibiotics.
And this is a problem family members have. They if somebody gets into treatment at one of the agencies, the family members will call up and say, why can't you fix it? Isn't there a drug that absolutely works? You know, when is my child or my partner going to snap out of this and be normal again? And you know, it doesn't happen. You have no control over it. But what NAMI does for you, it gives you understanding. It gives you insight into other people. You learn how to make accommodations. That, you know, if people have challenges, you make accommodations in your behavior for them, it really works. And there are several books that were really helpful to me. One of them was called "When Someone You Love Has a Mental Illness." It's by Rebecca Willis, and she has guidelines for family members. When should your family member live with you? When should you ask them to leave? And so it's helping you figure out, you know, when are you enabling somebody by letting them do everything? And when do you have to say, you know, as I had to say with my son, you have to leave. You cannot live here. You cannot live here and do what you're doing. And I didn't feel perfectly comfortable doing it, but I knew that that is something that I had to do for me and for him. And it's hard for parents to draw those lines. But this gives you permission to do it, to do what you have to do.
Yes. So not only does NAMI offer support, they also are in the business of advocacy. And I know that one of the things the retreat's been doing this year is our Stand Up to Stigma campaign, where we're trying to address the perceptions and the prejudice about mental illness, that it's something that is self-indulgent, that the person who has it lacks moral character, that they're trying to get away with something. And what we'd like to do, instead of actually this being an illness. And what we'd like to do is change that perception. But it sounds like NAMI's been doing this for a long time.
We have. We've been around, what, 79 or something? We've been around a long time, and we've been fighting prejudice every place we can. And one of the things we do is through education. We educate families. We have a provider education class, which we have had at the retreat, which we're going to have at
What does
Howard.
that mean exactly, provider education?
We have a team of 5 people. 2 people living with mental illness, 1 mental health provider, and 2 family members. And it's all scripted, it's all written out, it's all perfectly assembled, and it's a way of bringing the reality of mental illness to people who are providers, who are the case managers, who are, if we can get them, psychiatrists and psychologists, and anybody. We've had police officers. We've even had bus drivers come to, you know, I want to understand what's happening with the kids on the bus. How am I supposed to talk to them? And so it's a very powerful course, and it gives individuals insight into what's going on with family members. When you're a case manager and a family member calls you up and they're really upset because you can't fix it, you learn to listen with compassion and hopefully refer people to NAMI, saying, I've got a great group for you that's going to help you cope with with things you're dealing with today.
How would providers access this?
Oh, the providers, it is paid for by the state of Vermont. They pay for the program, and we have agencies sign up, and Howard signed up. UCS has had it, I think, 3 times, and all new hires come. And last time we did it at Howard, I think we had 30 people in the room who are some of them are direct service, some of them are, you know, executive, you know, management people. And it's a way of bringing insight into their lives about how to deal with people who are living with mental illness and their family members and have better outcomes through education.
Could a group of private practitioners access this as
Absolutely.
well? If they have a group got together and...
Yeah, absolutely.
Now we're going to have all the contact information, including your home phone number and your email at the that's going to be available at the end of the program in the credits. Yep. So, and you had said that you're perfectly willing to have people reach out to you.
I absolutely am, because it's all about education, and none of us were born knowing anything. And the only way you can know something is is to inquire, is to get the information, because the information's out there.
So, Claire, here we are, and we know that we live in a country where, 1 out of 17 Americans live with a serious illness, such as schizophrenia or bipolar or major depressive disorder, and 20%, at least by the NAMI's calculations, 20% of youth between the ages of 13 to 18 experience severe mental disorders. And yet, we're still as a society, we stare past it, we pretend it's not there, we're suspicious, there's an air of judgment, except if you happen to watch reality TV and kind of and it's somebody else's problem. There's a denial still going on. So people with mental illness, they stay silent and they don't reach out for the help they need. What's going on in 2015 it's still the case?
Well, I think the major problem is ignorance. I mean, if my son wasn't living with mental illness, I wouldn't know more than anybody else. I mean, you watch television, you watch movies, and people are afraid of people whose behavior seems to be out of control. And they have no background, they have no understanding of what's going on with that individual. And, stigma is alive and well, and I think stigma about mental illness is probably the last frontier with mental illness. When you think about HIV, when you think about gay people, when you think about transgendered people, we're moving in the right direction of accepting a wide variety of people. But the stigma about mental illness is profound. It is everywhere, and it's because people don't know that what you don't know, you're afraid of. And I think one of the first places we should start is with police officers.
How would you do that?
Okay, we have a program that's been very successful in Nashville.
Nashville, Tennessee.
Nashville, Tennessee. Sam Cochran wrote it. It's the crisis intervention team, and it's a way to train officers. And sometimes it's only 1 or 2 officers in a whole police force, but they are trained to go on calls that are concerned about somebody's mental illness or possible mental illness. And these officers are trained to de-escalate, to follow certain rules that everybody who deals with psychiatric patients should do. Don't approach them, don't touch them, don't raise your voice, don't give them orders to go down on the ground. Because if you have a cognitive dissonance in your life and a police officer is going to tell you to jump on the ground, you're not going to do it. And it's asking people to do things they cannot do. And so education of police officers is really, really crucial. And it's not that difficult. And some of it's being taught at the police academy in Pittsford. But everybody needs more of it. And I think clergy needs more understanding, because I know from personal experience that some clergy are very, very, very closed-minded about suicide. That, they do not understand what would drive a person to take their own life. And they don't understand. And suicide is not a sin to me. It's not a sin. It's something somebody is in such deep despair and depression that it is the only reasonable, rational way to end their pain. And, it's really hard for family members, and so many family members have lost people. And it's with understanding and support and a mental health system that is responsive and getting rid of stigma, we are going to lower the rate of suicide. We're also going to lower the rate of seclusion and restraint, because seclusion and restraint is a treatment failure. I was on a call last night with Ken Duckworth, who's NAMI's National Medical Director, And he said, having somebody in restraints is having them run a marathon with their blood pressure up and everything else. They are confined, they are restrained, and yet all this is pressure on their human body. And it is a risk. It is a risk for death. Restraint. And we just have to work through all these things and understand what people who are living with mental illness need and what their family members need. And that's what I'm passionate about, and that's what I love doing.
You sound passionate about it. Let me ask you this. In the best of all possible worlds, if you had unlimited resources, what would you do to end stigma much more quickly than, what would you do?
Well, I think in terms of education, I would make sure that that actually elementary school teachers, high school teachers should have a course in mental illness and what it's about, what the symptoms are, and how to help young children, some of whom have behaviors that are mystifying. And there is prejudice in our society that seems to indicate that children cannot have mental illness. They can. I've had a woman say to me, you know, my child had bipolar disorder virtually from the time she was born. And you listen to parents, and we need to intervene at every educational level. Nurses, a lot of nurses don't know unless you have a psychiatric background in your education. And everybody needs to know about, you know, how you talk to somebody, you know, how do you behave, and be understanding and supportive. And one thing I love about the Connection Support Group is almost everybody in the group is very supportive of each other, and they listen to each other and they understand each other. And one of the strengths of being on Tyler 2 is to be with people who understand what you're going through, and to be with your peers and to be able to share things without...
And more and more what we're learning is the more people make connections, the more they're able to heal. And it's through human connection that we find the energy to heal.
I've had a friend tell me that being on Tyler 2, one of the greatest parts of her recovery were the fact that she could talk to people on the unit with her. She talks to her friends on the unit. I had a woman say today that, you know, this is my family. And she was looking at staff too. She said, this is my family. They're not out there, they're right here. And it's really very moving.
Very moving, yeah.
Yeah, that was today.
Wow.
Yeah.
So, how have you seen the landscape change? Where do you feel optimistic? Where do you see your successes?
I personally think that the Department of Mental Health and most of the people in the department are doing an excellent job. They have their focus, Nick Nichols, they have their focus on recovery. They have their focus on peer empowerment. They have their focus. We have Superior House in a new place in Burlington that has people who are reluctant to take medication. They don't have to take medication. NAMI realizes that medication does not work for everybody.
Well, sometimes there are dreadful side effects just in coming off it.
Yeah, but that's
even under a doctor's care.
That's why you don't do it abruptly. I mean, any psychiatrist will tell you, you know, if you're going off, and I approve of you going off, we're going to have a way to do it that is safe for you. That is safe for you. But those are conversations that you have to have with your doctor before you can't do it yourself. You don't have the background to. You have the information, and I always ask people. I said, do you feel your case manager and your psychiatrist are listening to you? And I tell people, I say, you're the expert on your illness because you know what meds are doing to you and for you. You know what meds are working, and you have to share that with your provider. I mean, a psychiatrist can't look at you and tell what's working for you. I mean, he hopefully has an engaged conversation with you, And you're going to share that with him because he needs to know. And another suggestion I have, and I'm not supposed to make suggestions, is when you go see your psychiatrist or your case manager or anybody, take a sheet of paper with what you want to cover. So you make sure, especially with your psychiatrist, that you're covering what you want to say about the meds and what's happening to you.
And it's difficult
physically.
because now psychiatric visits can be so short that people, if they aren't organized about it, and also I'm thinking about what you said before about if someone has a hard time answering a question or it takes them a longer time, are they getting shuttled out of offices too fast?
Well, I would hope that most psychiatrists know that this delay in response is part of somebody's illness, and you have to wait until they can process it. And I've suggested to clients that sometimes you need to say to your doctor, can you repeat back to me what I've just said to you? And the doctor should be able to do that, and then he or she should say back to you, do you understand? Can you tell me what I just said to you? I mean, this is all active listening, but it's a way that you know that you're communicating. I mean, it's so simple, it almost doesn't deserve saying, but that doesn't mean it happens, But I find that most people in the department, at the retreat, at Rutland Mental Health, everyone works there. It has the same goal. It's what is the best thing for the client. And that's why it's wonderful that all the hospitals are working on the 6 core strategies to eliminate seclusion and restraint, because we're all on the same page that it doesn't work for people. And it's a restraint is a way to stop behavior. It's not part of treatment. And we all know that, so we're all working on it.
Claire, tell me, because we only have a few minutes left, what's up for your next decade?
Well, I'm gonna keep doing what I'm doing until I can't do it anymore.
Great.
And I love it. NAMI is family. It's like people probably feel this way when they fall into a support group. You fall into a group of people who understand what you're talking about, who understand shared experiences, who are caring, intelligent, marvelous, wonderful people. And you just, like that individual today, she said, this is my family. You find people you can share with.
And you don't have to be isolated.
You don't have to be isolated because, everybody's in the same boat. We're all in the sandbox trying to figure it out.
That's right. So, Claire, thank you so much for
thank
joining
you. I enjoyed
us today.
it.
You had so much information that's important, and we will make sure that all that contact information, all those great resources that you mentioned today.
And this is our family resource. This is our family resource guidebook. It's just in the office now, and we have.
Is this a new one? The newest one?
Absolutely new ones.
2015-16. I read the old one.
Well, anyway, I have a box in my car, so if anybody needs it, they can call me, and I'll arrange to get it to you.
Fantastic.
Thank you.
Well, thank you so much for joining us once again for Keep Talking, a community dialogue about mental health produced by the Brattleboro Retreat with Brattleboro Community Television, who helps us enormously, makes us look good, and, and we couldn't do it without them. Thanks, and please join us again.